Food poisoning is more common than most people think, yet many do not take it seriously until it becomes dangerous. Food poisoning happens when you eat food or drink water that is contaminated with harmful bacteria, viruses, parasites, or toxins. Sometimes, the food may look clean, smell normal, and taste fine, yet it can still make you very sick. Millions of people around the world suffer from food poisoning every year, and many cases go unreported because people think it is just ordinary stomach pain. Food poisoning can affect anyone, children, adults, and the elderly, but it is especially dangerous for pregnant women, older adults, and people with weak immune systems. In mild cases, food poisoning may cause discomfort for a few hours or days. But in severe cases, it can lead to dehydration, organ damage, hospitalization, and even death if not treated properly. The scary part is that symptoms do not always appear immediately. Some people feel sick within 1 hour, while others may not notice symptoms until several hours or even days later. This delay often makes it hard to know which food caused the problem. In this video, you will learn what causes food poisoning, how to recognize the symptoms early, what to do immediately, and how to protect yourself and your family. Because when it comes to food poisoning, knowledge can save lives. Food poisoning does not happen by accident. In most cases, it is caused by small mistakes that people make every day without realizing the danger. One of the most common causes of food poisoning is bacteria. Bacteria grow very fast in food, especially when food is left at room temperature for too long. Some bacteria cannot be seen, smelled, or tasted, but they can still make you very sick. Another major cause of food poisoning is viruses. Viruses often spread through unwashed hands, dirty surfaces, or contaminated water. When someone prepares food without washing their hands properly, viruses can easily enter the food. Parasites are another cause, although less common. They're usually found in raw or undercooked meat, fish, or contaminated water. Once parasites enter the body, they can cause long-lasting stomach problems. Food poisoning can also be caused by toxins. Some bacteria produce toxins that stay in food even after cooking. This means the food may be hot and fully cooked, but still dangerous to eat. One very common cause of food poisoning is poor food handling. This includes touching food with dirty hands, using dirty utensils, or preparing food on unclean surfaces. Cross-contamination happens when bacteria from raw food spread to cooked food. Another cause is improper storage of food. Food that should be refrigerated but is left outside for hours becomes unsafe. Leftover food that is not stored properly can quickly become a source of poisoning. Eating raw or undercooked food is also a major risk. Raw eggs, undercooked meat, and unpasteurized milk can carry harmful germs. Many people assume these foods are safe, but they can be very dangerous. Contaminated water is another hidden cause. Water used for drinking, cooking, or washing food can carry bacteria and parasites. In some areas, unsafe water is a major reason for frequent food poisoning. Food poisoning can also happen from expired food. Some people ignore expiration dates, thinking the food is still safe. Expired food may contain harmful bacteria even if it looks normal. Street food and food from unhygienic environments can also increase the risk. This does not mean all street food is unsafe, but poor hygiene can make food dangerous. The most important thing to remember is this: food poisoning is often caused by carelessness, not bad luck. In the next section, you will learn about the symptoms of food poisoning and which signs should never be ignored. Food poisoning does not affect everyone the same way. Some people feel mild discomfort, while others become seriously ill. One of the earliest and most common symptoms of food poisoning is stomach pain. This pain may feel like cramps, pressure, or sharp discomfort in the abdomen. Many people ignore this symptom, thinking it will go away on its own. Nausea is another very common sign. A person may feel sick to their stomach, even without eating anything. This feeling can appear suddenly and become worse over time. Vomiting often follows nausea. Vomiting is the body's way of trying to remove harmful substances. While occasional vomiting may not seem serious, repeated vomiting is a warning sign. Diarrhea is also very common in food poisoning. It may be watery, frequent, and uncontrollable. This can quickly lead to dehydration if fluids are not replaced. Some people experience fever and chills. A fever means the body is fighting an infection. Chills may come with shaking or feeling unusually cold. Another symptom many people ignore is extreme weakness or fatigue. The body becomes tired because it is losing fluids and fighting harmful germs. Even standing or walking may feel difficult. Headache and dizziness may also occur. These symptoms are often caused by dehydration or low blood pressure. They can be dangerous, especially for older adults. In more serious cases, food poisoning can cause dry mouth, dark urine, and little or no urination. These are signs of severe dehydration. Dehydration is one of the most dangerous complications of food poisoning. Some people may experience muscle aches or general body pain. This happens when the infection spreads or when the immune system is under stress. In rare but serious cases, food poisoning can cause confusion, blurred vision, or difficulty speaking. These symptoms require immediate medical attention. They may indicate toxins affecting the nervous system. Children, pregnant women, elderly people, and those with weak immune systems may show more severe symptoms. What seems mild in a healthy adult can be life-threatening for them. The most important thing to remember is this. If symptoms are severe, last more than 2 days, or keep getting worse, food poisoning should never be ignored. In the next section, you will learn about foods that are most likely to cause food poisoning and why they are dangerous. Many people think food poisoning only comes from eating outside. But the truth is, food poisoning can start inside your own kitchen. Let us look at the most common foods that cause food poisoning. First, undercooked meat and poultry. Chicken, beef, and turkey can carry harmful bacteria like Salmonella and E. coli. When meat is not cooked well, these bacteria survive and enter the body. The food may look cooked on the outside, but still be dangerous inside. Second, raw or undercooked eggs. Eggs can contain Salmonella, especially when eaten raw or half-cooked. Foods like raw cookie dough, homemade mayonnaise, and soft-boiled eggs are common sources. Third, unpasteurized milk and dairy products. Milk, cheese, and yogurt that are not pasteurized may contain harmful germs. These germs can cause serious stomach infections, especially in children and elderly people. Fourth, seafood and raw fish. Raw fish, sushi, oysters, and improperly stored seafood can carry bacteria and parasites. If seafood smells bad or is not kept cold, it becomes very dangerous. Food poisoning does not look the same in everyone. The signs can be mild in some people and very severe in others. Symptoms usually begin a few hours after eating contaminated food, but in some cases, they may take 1 to 3 days to appear. The most common sign of food poisoning is nausea. A person may feel sick to the stomach or have a strong urge to vomit. This happens because the body is trying to remove harmful bacteria or toxins as quickly as possible. Another very common symptom is vomiting. Vomiting helps the body push out contaminated food, but frequent vomiting can lead to dehydration and weakness if fluids are not replaced. Diarrhea is also a major sign of food poisoning. The stool may be loose or watery, and in severe cases, it may contain mucus or blood. This happens when bacteria irritate the intestines and prevent normal digestion. Many people experience stomach cramps and abdominal pain. The pain may feel sharp, squeezing, or twisting. This occurs because the intestines are inflamed while fighting the infection. Fever is another warning sign. A rising body temperature means the immune system is working to destroy the harmful germs. High fever may indicate a serious infection and should not be ignored. Some people feel weak, dizzy, or extremely tired. This is often caused by dehydration from vomiting and diarrhea, especially if fluids are not replaced. In more severe cases, food poisoning can cause dry mouth, dark urine, sunken eyes, or very little urination. These are signs of severe dehydration and require urgent medical attention. Children, pregnant women, older adults, and people with weak immune systems may develop symptoms faster and experience more serious complications. Food poisoning should never be ignored. Recognizing the symptoms early can help prevent serious illness and protect lives. Food poisoning can be prevented with simple daily habits. Most cases happen because of poor hygiene, unsafe cooking, or improper food storage. The first and most important step is hand washing. Always wash your hands with soap and clean water before cooking, before eating, after using the toilet, and after handling raw meat or garbage. Clean hands stop germs from entering your food. The second step is safe food preparation. Wash fruits and vegetables thoroughly with clean water before eating or cooking. Do not mix raw foods with cooked foods. Use separate cutting boards and knives for raw meat and ready-to-eat food. The third step is proper cooking. Cook meat, poultry, eggs, and seafood thoroughly. Undercooked food allows bacteria to survive. Food should be cooked until it is hot all the way through, not just on the outside. The fourth step is safe food storage. Do not leave cooked food at room temperature for more than 2 hours. Refrigerate leftovers immediately. Keep food covered and stored at the correct temperature to slow bacterial growth. The fifth step is safe water and clean environments. Drink only clean, treated, or boiled water. Avoid food prepared in dirty environments. Keep kitchens, cooking surfaces, and utensils clean at all times. By following these simple steps, the risk of food poisoning can be greatly reduced. Prevention is always better than treatment. Most cases of food poisoning are mild and can be managed at home. The main goal of treatment is to prevent dehydration and allow the body to recover. The first and most important step is fluid replacement. Drink small amounts of clean water frequently. Oral rehydration solutions are best because they replace lost fluids and minerals. Avoid alcohol, caffeine, and sugary drinks, as they can worsen dehydration. The second step is rest. The body needs energy to fight infection. Avoid heavy activities and allow yourself to rest until symptoms improve. The third step is light and safe foods. Once vomiting stops, start with soft foods such as plain rice, bananas, toast, or boiled potatoes. Avoid oily, spicy, or raw foods until fully recovered. The fourth step is medication caution. Do not take antidiarrheal medicines unless advised by a healthcare professional. Some medicines can trap bacteria inside the body and make the illness worse. Antibiotics should only be taken when prescribed by a doctor. However, medical help is needed immediately if symptoms become severe. See a doctor if there is persistent vomiting, high fever, blood in stool, severe abdominal pain, or signs of dehydration such as very little urine, extreme thirst, dizziness, or dry mouth. Children, pregnant women, elderly people, and individuals with weak immune systems should seek medical care earlier, even if symptoms seem mild. Early treatment saves lives. Knowing when to seek help is just as important as home care. Food poisoning does not affect everyone in the same way. Some people are at higher risk of severe illness and complications. Children are especially vulnerable. Their bodies lose fluids faster, and dehydration can become dangerous very quickly. Elderly people are also at high risk. As the body ages, the immune system becomes weaker, making it harder to fight infections. Pregnant women must be very careful. Certain foodborne bacteria can harm both the mother and the unborn baby, sometimes leading to serious pregnancy complications. People with weak immune systems, such as those with chronic illnesses or undergoing medical treatments, may struggle to recover and can develop severe infections. Food poisoning can lead to serious complications if not treated properly. Severe dehydration can cause kidney failure. Some infections can spread to the bloodstream, leading to life-threatening conditions. In rare cases, long-term digestive problems may develop. This is why early recognition and proper care are critical. High-risk individuals should seek medical attention as soon as symptoms appear, even if they seem mild. Food poisoning is preventable, treatable, and manageable when handled correctly. Awareness saves lives.